வணக்கம், குட் மார்னிங். என் பெயர் டாக்டர் பிரபாகர். இந்த வீடியோவில் we are going to discuss about the erythropoiesis. Erythropoiesis is the important university essay question. It may ask us the sometimes short notes. So you have to know the sites of erythropoiesis and steps of erythropoiesis. What are the factors affecting the erythropoiesis? You have to know in this topic. So we will discuss in this video. Erythropoiesis is the process by which the origin, development and maturation of the erythrocytes occur. Sites of erythropoiesis in fetal life, it occurs in the 3 stages. The mesoplastic stage occurs in the first 2 months of the fetal life. The red cells are produced from the mesenchyme of the yolk sac. It produces the red cells in the first 2 months of the fetal life. And from the 3rd month of the fetal life, red cells are produced from the liver, spleen and lymphoid organ. This stage is called as a hepatic stage. Last 3 months of the fetal life, the average fetal life duration is the 10 months. The last 3 months, red cells are produced from the red bone marrow and liver. It is called as the myeloid stage. The postnatal life after the delivery of the baby is called as the postnatal life. Up to the age of 5 to 6 years, the red cells are produced from the bone marrow of all bones. All the bones produce the red blood cells. From the 6th year up to the 20th year, from the 6th year to the 20th year, red cells are produced from the red bone marrow of the long bones and the membranous bones like clavicle. After the age of 20 years, red blood cells are produced from the membranous bones like vertebra, sternum, ribs, scapula, iliac bones, skull bones and the end of long bones. During the disorder of the bone, the red cells are produced from the spleen also. This image depicts the stages of erythropoiesis. Stem cell is the mother cell. It gives the committed stem cell. The committed stem cells gives the burst forming unit of erythrocytes. It gives the colony forming unit of erythrocytes. It gives the proerythroblast. Proerythroblast gives the basophilic erythroblast, and basophilic erythroblast gives the polychromatic erythroblast. It gives the orthochromatic erythroblast, and reticulocytes forms the RBC. So see the size of the cells. Gradually cell size is decreases. Nucleus condensed, nucleoli disappear. So these things happen during the erythropoiesis. Each stage we will see separately in the further slides. Pluripotent stem cell is the primitive cells in the bone marrow which give rise to blood cells are called pluripotent hemopoietic stem cell. It has the property of self-renewal themselves and can differentiate into the committed stem cell for the erythroid series. Proerythroblast, otherwise called as the pronormoblast. It is also called as the megaloblast, derived from the colony forming unit of the erythroid series. The size of the proerythroblast is 20 micron. The nucleus is large with 2 or more nucleoli. Hemoglobin is absent. Nature of the cytoplasm is basophilic nature. Early normoblast, it is otherwise called as the basophilic erythroblast. The size of the early normoblast is average is 15 micron. The nucleoli disappear, condensation of the chromatin network is occur. It exhibits the active mitosis in this stage, and hemoglobin starts appearing in this stage. And the nature of the cytoplasm is basophilic nature. Intermediate normoblast, otherwise called as the polychromatic erythroblast. The size of the intermediate normoblast is 10 to 12 micron. The nucleus is present, still present. Mitosis is sluggish. Hemoglobin synthesis increases in this stage, and further condensation of the chromatin occur in this stage. The nature of the cytoplasm is basophilic, stained both basic and acidic type due to the presence of the hemoglobin. Late normoblast, otherwise called as the orthochromatic erythroblast. The size of the late normoblast is 8 to 10 micron. The chromatin network is very much condensed. Nucleus is the ink spot nucleus or pycnotic nucleus. Hemoglobin synthesis increases almost complete in this stage. Nature of the cytoplasm is almost acidophilic. The later stage nucleus is disappear. Reticulocyte is the immediate precursor of red blood cells, also known as the immature RBC, slightly larger than mature RBC. It contains a reticular network seen in the cytoplasm. Reticular network is the remnant of the organelles and nucleus materials. It can stain with the supravital stain. Normally 0 to 1% reticulocyte normally present in the adult human beings. Erythrocyte is the final product of erythropoiesis. It is the mature RBC. The shape of the mature RBC is the piconcave shape. Size is 7.2 micron. Hemoglobin present. Nucleus absent. The reticular network is completely disappear. It takes 7 days for development of the mature RBC from the proerythroblast. From the proerythroblast to reticulocyte takes 5 days. Another 2 days take from the reticulocyte to the mature RBC. Stem cell is the primitive cell. It has the property of self-renewal and differentiation into the committed stem cell. It forms the first forming unit and colony forming unit of erythrocytes. It forms the proerythroblast. It gives the basophilic erythroblast. It is otherwise called as the early normoblast. The hemoglobin starts appearing in this stage and mitosis occur. The polychromatic erythroblast, mitosis is active and otherwise called as the intermediate normoblast. In the orthochromatic erythroblast, hemoglobin synthesis is complete, almost complete in this stage, and reticulocyte is the immediate precursor of the RBC. RBC is the final cell of the erythropoiesis, is the mature RBC. Factors affecting erythropoiesis. Erythropoietin is the important hormonal factors affecting the erythropoiesis. 85% of the erythropoietin is produced from the peritubular capillary of the kidney. The remaining 15% is produced from the liver. Erythropoietin is the potent stimulator of the erythropoiesis. The erythropoietin secretion is increased during the hypoxia and anemic conditions. Other hormonal factors are thyroxine, it also stimulates the erythropoiesis, and androgen, the male sex hormone testosterone, stimulates the erythropoiesis. So males are having the higher count than the females, and estrogen, it is mainly present in the female. It inhibits the erythropoietin production, so it inhibits the decreases the RBC count in the females. Maturation factors. The vitamin B12 or cyanochromaldamine is the essential for the maturation of the erythrocyte. It is obtained from diet, so it is called as the extrinsic factor. Intrinsic factor of the castile, it produced from the extending cells of gastric mucosa. It is essential for the absorption of the vitamin B12 from the intestine. Deficiency of the intrinsic factor of castiles produces the megaloblastic anemia, because due to it will not reabsorb the vitamin B12. And folic acid also important for the maturation of the RBC. It is essential for the synthesis of the DNA. First class protein and amino acid essential for the synthesis of the globin. This is the protein part of the hemoglobin. And iron, this is also necessary for the formation of heme. This is a part of hemoglobin. And copper is important for the absorption of the iron from the GI tract. The cobalt and nickel also essential for utilization of the iron during the hemoglobin formation. Summary of this video is: erythropoiesis is the production and maturation of the RBC. It has different sites. During the embryonic life, it produces from the yolk sac, liver and spleen. After the postnatal life, it mainly produces from the bone marrow. It has the different stages, from the pluripotent stem cell to the committed stem cell, first forming unit of erythrocytes to the colony forming unit of erythrocytes, pro-erythroblast and early normoblast, intermediate normoblast, late normoblast and reticulocyte and RBC. What important factors required for the erythropoiesis are erythropoietin and thyroxine, androgen, estrogen, and maturation factors like vitamin B12, folic acid, intrinsic factor of the castile, heme, and proteins, cobalt, nickel. These are the things required for the erythropoiesis. Thank you for watching this video. If you are like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.